Welcome everyone to part 2 of the funding webinar series. This is writing and submitting your NNLM proposal for Region 1 grants. And to be clear, we are talking about specifically Region 1 grants, but some of the information might be or will be applicable to other kinds of funding. Continue on to the agenda, please. So last week, we did part 1. If you missed it, we will provide a link to watch the recording. So feel free to go back. All of these will be recorded for reference. There'll be 4 in all. Last week, we mentioned a brief overview of the 23-24 grant opportunities for Region 1, but we're going to go into more detail here. So Tony's going to talk about the Data Science and Services grant, the Health Information Outreach grant, and the Technology Improvement grant with more detail for you. We're going to discuss the funding process and timeline. We talked about it a bit last week, but we want to hit some notes of the really important dates for you. We'll talk about some pre-writing nitty-gritty, some of the information you need to gather and resources you might use as you're building your proposal. We will share the much requested examples of strong proposal sections. We make it easy for you. So hopefully those will be really helpful to look at and say, am I on the right path? Am I formatting this correctly, etc. And we aspire to have time for some Q&A at the end too. So please, feel free to ask questions. Feel free to use the chat box to ask questions as we go, and we'll address things as we see them, and hopefully we will see them. If not, repeat at the end and we'll cover it. But we're delighted you're here, and let's continue on, Tony.
Let me share the handout.
Oh, yes.
For everyone as well.
The handout will have all the links that we're going to talk about today. And this is just a reminder of who we are. We are the network of the National Library of Medicine. We are Region 1. And so we cover DC, Delaware, Kentucky, Maryland, New Jersey, North Carolina, Pennsylvania, Virginia, and West Virginia. There are 7 regions in all, and they're all housed at academic health science libraries. More information is there in the About link. NNLM also has offices and centers. So the offices, 2 of them are really more sort of internal for supporting the NNLM regions. So the Office of Engagement and Training is housed at the National Library of Medicine, and they basically oversee our program. They oversee a lot of other things too. The Web Services offices, that we fondly call NUSO, they are our tech support. So neither of those is particularly useful for you, but the Public Health Coordination Office and the Training Office both have resources that you may find quite useful, depending on what your focus is. The centers, there's 3 of them. We've got the National All of Us Program Center, and actually while I'm talking, let me type in the All of Us link here for anybody not familiar with the All of Us program. It's an NIH research program with a goal of gathering 1 million research samples to sort of even the playing field in terms of health research across the population in America. It's really interesting and it's growing. And they have their own funding too. So a different focus, but take a look at All of Us if you think it might be relevant. The Center for Data Services will be helpful to you if you are, focused on data. Now, we're all dealing with data, of course, but if the thrust of your project is data-centric, they have some really good resources there. Not the least of which, actually, is they have a list of NLM resources to promote in your project with talking points and guides about how to promote it as part of your project. The Evaluation Center is quite critical for you. So everything that you do, hopefully you'll have evaluation in mind, and you're going to hear this echo of us as we keep talking about it. And we'll say this over and over again, how important it is to build evaluation in from the beginning with your project. So the NEC does have some wonderful resources for you too. So please check all of those things out. Next, please. And just a reminder, we did cover the proposal writing toolkit last week, and Tony gave a demonstration of it too. So if you rewatch or watch the first webinar, you'll see the tour of it with a little more detail. But just a reminder that everything we're talking about in all 4 of these webinars will be reflected in this proposal writing toolkit, which is a fantastic resource recently updated we hope will be really, really helpful for you. And now I shall hand over to Tony.
So regarding Region 1's projects that we're looking for applications for, just a reminder from last week, we are providing one project award related to data science and services. So if you have a proposal idea, feel free to submit something on that. There will be 3 projects, health information outreach, and then 1 project which is related to technology improvement to help address issues related to the digital divide. So you'll notice that all of these 3 different categories, the project award amount is at $30,000. Just as another reminder is that all applications are cost reimbursable directly to an institution and not to an individual. So I want to make sure that everyone is aware of that. So for the data science and services projects, the focus is on something to help stimulate innovations in biomedical knowledge related to the collection, organization, or management or data science, information, or research services. The goal is to incorporate 1 or more of the following: increasing awareness, promoting data literacy, increasing data management skills, and partnerships are incredibly important. So you can partner with your CTSA or research departments related to this as well. So I also want to share a couple of recently funded projects that we are finishing up with, or we're still continuing with this year. One is utilizing artificial intelligence to analyze health status and literacy of chronic kidney disease patients in one particular state to identify gaps in evidence-based care. Another is to develop a program to teach data literacy through an escape room. Then there's providing a training symposia covering topics related to research data management. And another one is developing a data catalog to help improve research data discoverability. For health information outreach, the goal is to help improve health information literacy, improving their internet searching skills, and to basically help improve access to health information so that the public can help make informed decisions about their own health, especially when you're working with a healthcare provider. So here's some examples of some recently funded projects from us. That includes a group, a community-based organization who wanted to design and implement trainings based on the CDC's updated guidance on the use of pre-exposure prophylaxis to help with treating LGBTQIA+ patients. Another was related to looking at underlying causes of post-traumatic stress in college students due to the pandemic, and developing a curriculum that utilizes the trauma symptom checklist is another project. Then we have, for a public library, for instance, there was increasing access for patrons at their library by creating telehealth kiosks or booths where they can have private conversations with a healthcare provider. And then another project that we've recently funded was related to launching a Healthy Garden to Market program for youth and teenagers to help with nutrition education, gardening skills, plant-based cooking skills, and understanding commerce by having them also sell what they produce in these community gardens at farmers markets. So they get the full kind of experience that way. Lastly, there's technology improvement. The goal is to help with addressing specifically things related to the digital divide. So we understand that there's this need for technology to help with that. You can purchase hardware, software, mobile Wi-Fi devices, etc. And hopefully you'll include and incorporate health information as part of this as well. So some past project ideas included experiential health sciences education to help with virtual reality, providing new computers at a community center to help connect with the underserved populations and access online health information. There's providing technology to libraries after a natural disaster. We've done this after tornadoes hit areas or hurricane hit areas to help them with rebuilding and providing more access so that people can locate the information that they need. And then lastly here was the development of a podcast series to help with health and wellness for an underserved population that they've identified actually utilizes podcasts more than other types of communications. So one thing that Nancy and I both strongly encourage is if you have a project idea, share that with us in advance, and we can help you flesh out some details for you and try and make sure that it benefits you in the long run. If you're looking for other potential ideas, what I would strongly recommend doing is you can look for our projects that are funded if you're looking for new ideas, and can you replicate an idea as well in your situation. So you can go to Available Now, and the Available Now section under funding would show you some of the other projects that are funded, not just by our region, but by throughout the whole US. So you can get a glimpse and see what it is people are proposing and getting funded for to help give you new ideas as well. So with that, I will pass this on to, oh wait, was Nancy?
That's all right.
Take your slide?
That's all right. I was going to interject too. Does anyone have any questions about those specific grants? We're happy to answer any questions.
Hi, I have a question. My name is Portia with Black Girl Health Foundation. Can you hear me okay?
Yes, we can, and we know you well, Portia.
Oh, okay.
And I know the project that I mentioned earlier, you're probably working on that, right?
Yeah, absolutely. Well, when you were talking about health information, I just was wondering if you could elaborate a little bit for the Health Outreach Award. Did you guys want in particular NLM resources to be promoted through the health information that we're like, say we're trying to increase access to underserved patients for our clinic? Do you guys want us specifically to use different NLM resources as that health information promotion?
So for your particular idea that you're sharing, I would probably at least recommend Medline Plus to be incorporated within your proposal at the bare minimum.
Okay.
It just depends on what you also intend to do. There might be situations where they might be diagnosed with a disease that they're still like scared about, but they want to know if they've gone through so many options, are there any clinical trials? So they might want to be interested in like clinicaltrials.gov, or they might want to take research into their own hands, and they can utilize PubMed to do a database search and on that site to see what does the medical literature say, and can I grasp that information? It does depend on their own health literacy skills to begin with, and sometimes Medline Plus is where they start before they start branching out to other things. I will say that in Medline Plus, it does automatically connect people to clinicaltrials.gov and to PubMed as well, once they get to the topic area of their health concern.
That's what I was just about to ask that question. Like, can you access those like PubMed through Medline Plus? And then, okay, got it.
And I will also say that if you'd like us to share a Medline Plus training that you can just easily adapt for your audience, we have something available that you can use. And we'll reference that later on of like where our training guides and things that you can adapt for your own use can really come into play.
Awesome. Great.
So you don't have to start from the ground up if you don't want to. You can consult with us. Should your project be selected, you can consult with us and say, hey, I have these ideas. Would you be able to help me out? We can share some resources, or if you need us to do a webinar training, if you have a number of different volunteers, we can certainly support that as well.
Perfect. Awesome. Yes, that was my only question. Thank you so much for that. Tony. I
Sure.
appreciate
Oh,
it.
that's great. And we are big on not reinventing the wheel, and we've got a wonderful network, not only of colleagues who work with NNLM, but their entire membership in the network that are just wonderful about sharing information. So making it as easy as possible. Did anyone else have a specific grant question? And feel free to interject anytime, but just wanted to make sure that we give you a chance.
Yeah, if you have questions throughout this presentation at any point, you can raise your hand or you can unmute yourself and feel free to communicate. Nancy, should I move on?
Sure. Yeah. Just as Tony's saying, consult with us. We're here to help. You'll see our emails and our Calendly, grab a slot with us. Options are promoted widely for you. So use them. We're here to help. There's no idea that's, not good. I mean, we can help you shape anything up.
And again, I shared the handout that has all of those links as well.
Oh, great. Okay, so next we're talking about the awards process and timeline. We covered it in more detail in the first session, which, as I say, was recorded, and you're welcome to and encouraged to go back and review that. But we wanted to hit on some kind of key dates here. The deadline for applications for this round of grants is November 4th. So, and they're open already. So we hope that you feel equipped with some of our resources or discussions with us to shape up your proposal and get it in. We're pretty good to work with. We make it easy, I think. And we're starting earlier this year. So Portia knows that we had hurdles this year with getting things off the ground. So we are starting much earlier so that people can get started, earlier.
On time.
Yes, and have a full year to do their projects. So the notifications, if your project is selected for funding, you'll get them by January 13th. So that's when you'll find out. This is after we've reviewed and we've had some peer reviews and really synthesized all of the applications and the rankings and things. And for those of you that are with an academic institution, just keep in mind that in February, you may encounter, having to get some IRB clearance from your own institution if you're awarded. So May 1st is the other critical date we wanted to point out, and that is the beginning of the project. So all roads should lead to a nice launch May 1st. So keep those dates in mind, and there's more there for you if you're interested. Next, please.
So one of the things that I think is really important is to think about your project timeline. You'll see in our project award descriptions here, the period of performance is, we hope to be May 1st, 2023 is the start of your project, and it should end by April 30th. And that includes all expenses related to the project need to be completed by then so that we have the invoices in time. So I do encourage everyone to pay attention to the deadlines listed here. And we talked about deconstructing a notice of or a call for applications description. So again, you can look at that from the webinar last week to get an idea of things to keep in mind. Before I move even further, I think there is something new that I need everyone to be aware of. Federal guidelines have changed. We no longer collect the DUNS number. So instead, what they've mentioned is that we need to collect a unique entity ID number. And there is some guidance on how to apply for one if you are not familiar with that. And if you are at an academic institution, you can probably check with your sponsored programs office about your unique entity ID. But if you are a community-based organization, you might need to apply for one as soon as possible. So just as an FYI, that is something that you'll need to be prepared for. Sorry about that. I almost forgot to include that, Nancy, and I just clicked it.
That's important, yeah.
Yeah. But regarding drafting a project timeline, the one thing that I strongly encourage you to do is start working at the end and then work your way back. And this will help you in thinking more fully of like all the activities and all the tasks at hand that would be done up to the point of the period where you're actually analyzing or reviewing any evaluation that you've collected to help with talking about the success of the project or any lessons learned following the end of the project as well. So as you're thinking about the end of your milestone, you are thinking about the evaluation of your project. And we will go into a lot of detail next week, and that will also include creating your SMART goals and your logic models for your proposal. Portia, you have a question for the unique number. Can a link be sent out to us on where to apply? I just put that in the chat earlier. It should say like fsd.gov. It's an article that outlines more about the unique identity number. So that should help you with applying for that as well. So I would say that if you want to start looking at this guide on developing your evaluation, this will actually help lead up to all of the other information that you may need as you're developing your proposal. Nancy?
Okay, so getting into the nitty gritty, I'm sure everyone here is familiar with health statistics, and I know a lot of people cringe when they think about it, but they're also sort of necessary as well. And there's some really fantastic sites to help you. So a lot of these are pretty well known. I hope you've had experience with them. They're all very, very good resources for when you're trying to do a justification of need. Sung Yao is, oh yes, okay. So Sung Yao was asking, is the UEI a new item for the grants this year? And yes, it changed in 2021 to launch in 2022, said Tony. So yes, this mixed things up a bit for people because we finally got people in the group with DUNS numbers, and now now a change. But so far so good. I think the process is fairly smooth from what I've heard so far. But anyway, about the health statistics, I think most people are familiar with using them for justification of need. So when you know that you've got some partners in a community, you have consulted them about their concerns, even though you have statistics. Never ever go into a community and tell them what the concern should be. They may have a focus that's very different. But whatever you decide on, you do need to back up the justification of need by providing statistics. And these resources are really good. But I wanted to highlight a couple that I've found really helpful for a different use of statistics, which is at the very beginning, when you're trying to get buy-in for your project from your own organization often, or from community partners. I find county health rankings and roadmaps and the Rural Health Information Hub can be super helpful. Now, all of them can be, but with the next slide, I'd like to show you just what I mean.
Oh, before we move on, I think
yes.
Sung Yao has another question for us.
Oh, sure.
Yeah. Sorry for the interrupting. I just want to clarify something about that unique entity ID. Is that I was told by one of my colleagues about a NNLM ID from a grant before. So I wanted to clarify, are those the same thing, or
no?
We need to
yes.
apply for a new one, right?
Yeah, thank you for asking, Sung Yao. So the NNLM ID is your identification for your NNLM membership. It's basically your membership number. And you do need to provide that when you're applying for funding. And with a few other resources that are perks with membership, you'll have to provide that number. That's how we identify you as a member. The EUI is totally different.
That's a number that's provided by the, I forget the organization, but it's a federal type thing where that NNLM member ID number is just like for Towson University where you're at.
Yeah,
So
Does that
it's like
help?
a sam.gov assign that kind of something.
yeah.
Thank you.
That's a great question because it can be confusing because there's so many numbers and there's so many, so much information to provide. I know it can be a little mind numbing. And again, let me remind you, Tony and I are here to consult with anyone individually as well. If anything pops into your mind after the webinar, just reach out. We're here. But regarding these health statistics, a lot of them are going to be familiar to you, but I'd like to forward to the next slide, Tony, because I just wanted to highlight something in terms of statistics that help you get buy-in from people. So one from the county health rankings and roadmaps that I used to use in community outreach, and people would just be, horrified to say, if I was working on Baltimore City, say, we're 24th out of 24 in Maryland. When you're tossing that out to, and the categories, by the way, are spelled out in other ways too. It's not this vague. So you can break it down to specific health and health outcome categories. But when you want to get buy-in and just say, hey, look, we've got a problem or problems, please help. That's one thing that really hits people. If you'll do the next slide, please, Tony. And one of the things about county health rankings and roadmaps too, this is the more granular information it will give you. And this was Baltimore City that I put in there. You can get into the granular things and compare it to the state overall, which also can be really, really poignant for people in terms of, just waking people up to the problems and getting them to say, well, I've got it, we've got to do something. But one thing that's very helpful too is that County Health Rankings and Roadmaps has this action center. So a lot of times, when you're doing the cumbersome stuff at the beginning of gathering the data and getting the buy-in from people and all of that, it's easy to sort of say, oh, wait a minute, what's next? What's next? Hopefully our toolkit helps you, but there are other resources too, like this action center at County Health Rankings and Roadmaps can be excellent. So just wanted to toss that out. The next one is just a screenshot from the Rural Health Information Hub. They have something called the Rural Data Explorer. I just picked Kentucky here, and you'll see the most recent data is 2016 in this particular example, so be aware of that. Some of them go up to 2020. I think the 2021 isn't quite posted yet, but in terms of information that's out there, you can get this breakdown of information and focus on your specific instances that you and your partners want to work on or want to highlight, or this can help you get buy-in from people. So I just wanted to show those two things quickly. These are not National Library of Medicine resources, I should say, but they're very, very good. And we will talk a little bit about NLM resources in a bit. Next, please, which I think is you, Tony, maybe, or is it me? Oh, it's me. It's me. So I said it was coming, and it is. So these are resources that you will want to consider including in your proposal in terms of how it's going to help you with whatever audience you're working with. As we talked with Portia about Medline Plus earlier, the big three generally are Medline Plus, PubMed, and clinicaltrials.gov. One of the things with clinical trials that's really neat is you can see the most recent information now. It's so much better in terms of the reporting because of requirements, but you can see the most recent information that's been done on a clinical trial on a particular subject. And so a lot of people, even general public people, get very, very excited about that. It can be really helpful when you run into dead ends with health information in more, general ways with Medline Plus or with some scholarly articles from PubMed. It can be sort of the cutting edge info. But those three are the biggies, but they're all great and all can be very, very useful. Don't forget too that we've got NNLM training workshop PowerPoints, as we were saying about being pretty good at helping people not reinvent the wheel. There's entire classes that are there that are we don't copyright anything. We share it all. You can take it, update it, always check to update. We aspire to, but always make sure. You can customize them. They have scripts, handouts, and all of that, make it very, very easy. And don't forget to look at your NIH Institutes directories as well. I would keep meaning to look this up. There's around 30 of them, specializing from things to eye health, to cancer, to complementary medicine. I mean, all sorts of different things. And depending on your focus, it can be very helpful to look through those institutes and see what resources they're promoting. There used to be a lot more, I think. Budget cuts have cut them down a bit, but at the very least, there's some very good downloadable PDFs as well. But take a look at these resources and make sure to include this kind of thing in your proposal. We do hope to see NLM products reflected and used. They can be extremely helpful. Medline Plus, don't forget, has patient handouts as well. So you have if you've got a really specific topic, most of the topics have handouts that you can print out. That makes things easy. Library carpentry, for those focused on data, is an incredible resource, which Tony could wax more poetic about than I could.
Well, I probably placed that in the wrong area, in all honesty, because NIH, NLM, and NNLM did not develop library carpentry.
That's
It
true.
is a separate organization entirely. If you go to library carpentry, and you can do a search on that online in your favorite search engine, or you can utilize, you can go to data carpentry as well for more advanced skills related to specific topical areas there. But they offer training programs related to data science services, but it is also practical skills. And that can be really helpful for an institution who's still trying to develop and build their data services and support for their entire organization then.
Yeah, and thank you, Tony.
Sure.
The All of Us research program I mentioned earlier, but again, a reminder that they do have their own funding. So check that out. And we have informational and printed materials as well. So don't forget about that. They're free. The shipping's free. A lot of it's downloadable yourself, so you have complete control over it. But the items that we ship, like bookmarks and such, completely free. The shipping's free, but plan early because it's free. We have quite a demand. So don't wait until the last minute to get your supplies. Does anyone have any questions about these resources or the others that we were talking about?
And also, if you have a particular project and you identify resources that were not mentioned right here, let us know. I mean, we'd be open to hearing something new and innovative that might be out there that really reaches your specific audiences that you're trying to connect with. So I don't necessarily, I mean, yes, we list all of these as potential ones that we have connections with quite easily, but if you know of another resource that is much more viable and beneficial for your community, I would be okay with that. You just have to be able to explain it to me.
Yeah.
Can we see all the training that you offer? So let's go visit that. Takes a bit of time to load.
Yes, our website's a little slow.
But yes, so this is our class catalog, and it lists all of the different titles of the classes that we have. And you can see how many hours it takes to complete it. Things can be adapted to fit your need, but let's look at, say, Beyond an Apple a Day, providing consumer health information at your library. I believe when you go to click on the class itself, you'll see a brief description of what the class is, its objectives are, and then you should be able to see, say, a PowerPoint, if it's downloadable or not.
I think Caring for the Mind might have an updated one. And the
Sure.
other thing is, if there isn't a PowerPoint, the person who is managing the class, their email is listed right there. Don't hesitate to say, I'm really interested in the content of this class. Can you share it? We're very used to that.
I think it's gone, but feel free to reach out to the class owner So you can contact the training office for the PowerPoint. You can also talk to us and we can try and dig for that as well. So these are a listing of all of the different classes that we have. And sometimes some of them are available as a webinar that you can also watch if you'd like to see the information in advance to see how it was presented. And then, oh, here's one. You can see download the slides for the webinar. So you can click on that, it downloads the presentation, and then you should be able to open it. And you should be able to view it as well once it's opening PowerPoint. So does that help, Portia? And if there's something that you discover, you are free to let us know as well. And you can adapt the slides to fit your particular need because these can be edited yourself. So if you want to have your brand and everything on them, feel free to do so. But this outlines a lot of information related to health communications and health literacy, so that you don't have to start from the ground up. Most of our PowerPoints are already scripted as well. And I think that will help you too, so that you don't have to work on writing your script or what you need to say on a particular slide that shows up too. So that can really help a lot of you in saving time and not have to worry about developing anything from the ground up.
Yep. And in a lot of instances too, you'll be able to find the class presented on our YouTube channel, and not in all cases, but in a lot of cases. And that way you've sort of got this free training session of watching, train the trainer session of watching it and then being able to do it yourself.
Yes, strongly encourage taking something that we've developed and adapting it so that you don't have to do it from the ground up. And we use a lot of the language that is preferred by both NLM and NIH as well. So Sung Yao, you're asking about talking about a project that you want to implement with another organization. You can contact us by email and we can schedule a consultation related to the data services project that you're interested in. So yes, you can email us, and we have that information in the handout of email, as well as scheduling a consultation if you'd like to do that individually too.
Yes, and everyone, please don't hesitate. That's what we're here for. So we definitely here to help.
I mean, hopefully you can find the time available in my scheduler, just like Nancy. Some weeks are a little more full than others, so I'll just leave it at that. Is there anything else we need to mention on this slide, Nancy?
I don't think so. But again, if any questions occur to anyone, contact us and we'll happy to address them. The next slide, we want to remind you that, you know, if you know that you are with an organization that is going to apply for funding and always be interested in funding, one simple thing you can do to clear hurdles is to set a time with yourself and the whole team that every single year or whatever increment feels good to you, but at least every year, that everyone has an updated resume or CV in a shared location. This is so important because when you're putting together the proposal and you're you know, talking about the staff and how great they are and how they have this experience doing this, that, and the other thing, that it's easily accessible. But one thing to remember too is, depending on the particular grant you're applying for, it's the same as applying for a job, where I'm not saying lie, but people, you know, you beef up your experience in, you know, maternal health. If you've done work with maternal health and the grant is going to be concentrated on maternal health, make sure that you're highlighting that experience. Maybe you can take away some other experience that isn't as relevant and shape your resume for that particular grant. That's completely makes sense to do. It helps a lot. It helps your staff really shine when someone's reviewing proposals to say, wow, they've already done this, or this person comes with this experience, so this is going to go very well. So two things: keep them updated in general, and then customize them for a particular grant, and just have them ready ahead of time if you can. And that'll clear a lot of hurdles for you in terms of time.
And it highlights your
about that, Tony?
expertise.
What?
It just highlights your expertise in whatever it is that you're proposing that you'd like to do as well. And that wins brownie points with your peer reviewers because it saves them a lot of time doing guesswork as well. Oh, okay. So now we're going to, oh, this is the fun one. Thanks, Nancy. So now I'm going to show everyone the where to find exemplary sections of a proposal. So I know that for a lot of people, writing a application for a grant is kind of a daunting task. So we want to try and help minimize that by highlighting where you can locate some information on some examples that you could utilize and maybe see, oh, this is kind of what they're looking for and what they want to see when I'm writing. It's my own application itself. So if we go into the proposal writing toolkit, you'll see the different tabs that are listed here. Under review and selection of proposals, you can just click on that and scroll down, and you'll see a section here just simply listed as examples. And here you'll find exemplary samples from project proposals that correspond to the criteria that our peer reviewers are looking at when they're evaluating your proposal. So you can download each of these particular ones. And if you do that, you can see what we're looking for significance, as an example. And you can see how they're thoughtfully written out, like 3 paragraphs on what the significance of their proposal is about. Regarding the methods, you'll be able to see all of the different how they've structured their methods to match what it is that they're doing for their project. Do you need to do it exactly the way that this is set up? No. Every organization has their own style and approach to writing a proposal. But at the same time, you want to win over the peer reviewers. And we'll talk about what peer reviewers are looking for at a later session. But I wanted to at least make sure you're aware that there are some examples that if you wanted to start thinking about how you're going to propose things, you can certainly do that. And again, we're going to cover the evaluation. I think it's the next session, I think, Nancy. I can't keep forgetting.
I believe so.
But you can get an idea of how they're utilizing a logic model to help with the development of their evaluation in advance before you even begin writing. This is something that you should start thinking about of how you're going to approach your activities to reach a specific goal. And then if you are curious about, say, developing a budget, you can see how you can structure a budget here. Sorry. To see how we're looking for specific details. So you could say health outreach librarian, and you can say, oh, we're expecting about 200 hours of work. This is the hourly rate, this is their fringe rate, and this is the total amount, right? So you can see an example of the equipment that might be used, the level of detail that we're looking for, like, oh, you've identified a whatever tablet that you'd like to purchase. You've looked at, say, what the warranty is. You cost it all out, and then you figured out how many that you may need for your totals for each category. If there's travel involved, think about mileage. You can think about any consultants that you may want to hire. So those are things that you should think about as you get to your total budget. And this really helps us realize and recognize you did spend time on budget versus saying, oh, I say about $10,000 for, say, staff, or I say maybe it'll be about $800 for travel. We need to see a level of detail when you're working on your budget. And I think we might be covering a little more of that later too, actually. And then, so you'll see also project staff as an example. Some of the detail that's involved there, you can get some examples of the additional information about their extensive qualifications that could be identified in their CV, right? So this is something that we are looking for to make sure that if we give you some money, you'll be able to really accomplish that project without many issues. And again, I don't necessarily expect all of this detail when you're working with a uh, underserved population, but I would like to make sure that you're like really being cognizant about the medically underserved population, especially when it comes to health information outreach awards. I think that answers this particular slide. And then I think that basically goes to Nancy now.
Yeah, so that's all we're covering for today. For next week, probably we have the most jam-packed, ambitious of the four webinars. Now, if any of you have done logic models and SMART goals before, you know that you can do an entire weekend, workshop on one or the other. So for us in 1 hour, it's going to be, we're going to address logic models and SMART goals, but it will not be intensive. But that said, we're happy to work with you individually. So next Tuesday, same time, same place, we will do part 3. We will talk about telling the story, and make no mistake, your proposal is telling a story. We liken it to like a newspaper story, like a human interest feature, where it pulls you in, it makes you care, but it definitely has facts and figures, and it definitely has been researched thoroughly, so you're going to do all the research and all the nitty-gritty and build it into a story to compel the readers to care and to believe in you. We will cover logic models and SMART goals, but pretty briefly. We'll talk about the various connections that are important to be reflected in the proposal, and about tying it all together. It's a lot of different components. We also are sharing here and in the handout the previous recording for part 1. So please take a look at that if you didn't see it yet, and register for part 3, which will be next week. The link is right there. And again, they'll all be recorded as well. And I think our last slide is, do you have any questions for us? We also have our emails there and our calendars where you can grab a slot for consultation with us. Are there any questions?
And one thing I will say is, if you go to the link that I provided for you and you scroll down, if you go to previous classes, you'll see the session that we had last week. And if you open that, you should be able to see the recording if you wanted to watch that, if you haven't done so yet, or you need to refer back to it, you can do that. You can also see the presentation as well as the handout is available for download as well. So that's something that is available for you if you missed the webinar earlier or just want to refer back to that. But if anyone has any questions, you can schedule time with us or send us an email automatically. But I will do a stop share so that if you'd like to chat with us, we are available right now. I did jazz hands again. I'm sorry.
I just have one quick question again. I'm sorry. This is
No, you're good.
Never apologize, never.
Is it required to have a partner for this, or like, I know usually there's support letters or partnership letters. Is there a requirement at all for partnership?
It's strongly encouraged, but it's not a requirement.
Okay.
Yeah, it's not a requirement, but with competitive grants,
Sure.
A project that is proposing community partnerships is going to impress a little more than one that doesn't. Now, that said, it completely depends on what you're doing. I mean, there are some things that, that if you're doing it, a partnership doesn't make sense. And certainly the reviewers would know that.
Yeah.
Got it.
But if you do have a partnership, getting a letter of support from that partner who outlines specifically what they're doing can really make a reviewer think about your partnership with that organization positively.
Got it. Well, another question to piggyback off of that. So a community partner is definitely encouraged. However, now if your project may not necessarily warrant a partner, you mentioned support letter. Can that support letter come from someone who has partnered with us in general, or may not necessarily be involved in this project, but has been involved in initiatives with us to support, kind of who supports what we're doing? Would that be suffice, or are you referring to a support letter in particular with someone who's actually involved in this particular project that we're proposing? Does that make sense?
Yeah, so you're asking for the difference. Would a letter of reference be
Okay, yeah,
sufficient
I guess
versus
that
a letter of support?
Yeah.
A letter of support is more preferred over a letter of reference,
Got it.
because there are people that can say, oh, I know that you're with Black Girl Health. They do a great, fantastic job. I know that. Yeah, I could write a letter of reference. That doesn't mean anything, because they don't know if they're actually going to be involved with the
Sure.
activities or anything like that. So if you, it just depends. But really what people want to see when there is a letter of support, how are they supporting the success of the project itself at hand? That's what's really preferred.
Got it.
Yeah, and partners can come from unusual places. I mean, it's easy to think about community partnerships and targeting the community center, the Department of Health, or the senior housing unit, or the school, or whatever. But depending on the project, if you're doing a community garden, obviously you're working with the community, but maybe rather than going to buy the seeds with money, maybe you're going to partner with a farmer in the area, to get the seeds, or to get the plants or the seedlings. There even things that you can do yourself. Sometimes you can think about expanding a little bit to involve another organization or community member.
Or Parks and Rec might be able to say, yeah, we can certainly develop, allocate a little bit of space to help with this for our summer program on gardening as well. And that could really help out. Sometimes it's, I know personally that some things just sound like, oh, I can just do this easily by myself without any issue. But for us, and for peer reviewers, many times we're thinking, how are you really engaging with the community then? Are you touching base with other community leaders to really help expand your organization specifically and help build better relationships and make a stronger organization for you yourself, because you're more ingrained within the community then?
Love it. Thank you so much. This was really helpful. Thank you, guys.
Sure.
Great.
Are there, oh, Christine?
Sorry. Referring to letter of support and
Yes.
as opposed to letter of commitment, which one is preferred, or it doesn't really matter?
There are some slight variances in the definitions, and sometimes I need to hear your definitions of what you mean by when you say letter of support versus letter of commitment. So if you work at an academic institution, sometimes the letter of commitment means, okay, we are asking for you to cover 100 hours of our staff to do this project. We will commit them another 150 hours so that they can successfully complete this project. It just depends on what you mean by each separate definition. Does that make sense?
Yes, it does. Thank you.
Yeah, and the difference that Tony was spelling out earlier involving a letter of reference versus a letter of support or commitment, the lingo gets tricky with those. Support and commitment, sometimes it's the same thing.
Yeah, sometimes it is.
Sometimes it's the same thing, but the letter of reference is really one to differentiate between the letters from partners who are saying, we are part of supporting this, we are committed to this. Whereas reference is, hey, you know, I know Christine, she's terrific. She'll do a good job at this. And that's nice, but it's much more informative for us that someone is saying we're dug in and committed and we're going to be part of this.
Yeah.
Thank you. Yep. Thanks.
Language is tricky, Nancy.
It is very tricky, and lingo.
English language is really hard.
Are there any other questions?
Christine, do you still have your hand up, or?
Now I'm trying to put my hand down.
Oh, okay. That's fine. I just wanted to be sure.
I relate, Christine. I was being enthusiastic once and tried to do the clapping thing, and then I was clapping through the whole thing. I was like, I'm really not clapping anymore, I swear. I couldn't make it stop.
So I want to thank everyone for their time. Again, Nancy also shared in chat our scheduler as well as our email addresses if you want to contact us directly or you'd like to schedule a one-on-one consultation with us. I think my scheduled consultations are between 9 to 5 generally on a weekday. But I do have a lot of other activities. So if you don't see a time that works for you, please send me an email and we can work out a time that works mutually for both of us. I'm sure Nancy is the same, but we wanted to give people options.
Yep. So we are here. You use your helpers.
And just know that we want to make sure that you're successful because we're not really the peer reviewers. They go out to people most likely outside of the state who aren't even a librarian. They might not be a community-based member, or they are community-based member, but they're not part in your field particularly. So again, writing in clear, concise language can really win over the peer reviewer. All right. Well, thank you everyone for your time. I really appreciate that. And look forward to seeing you at next week's session, or if you'd like to schedule some one-on-one time with either Nancy or I, we'd be happy to meet up with you. So thanks everyone and have a good afternoon.
Thank you all for coming. Bye-bye.
Bye.